Hello, today we will discuss together patient information leaflet about birth options after previous cesarean section. How common is it to have a cesarean section? More than 1 in 5 women in UK currently give birth by cesarean section. About half of these are as a planned operation and the other half are as an emergency. Many women have more than one cesarean section. What are my choices for birth after one cesarean section? If you have had a cesarean section, you may be thinking about how to give birth next time. Planning for a vaginal birth after cesarean or choosing an elective repeat cesarean section have different benefits and risks. In considering your option, your previous pregnancies and medical history are important factors to take into account, including the reason you have had your cesarean section, whether you have had a previous vaginal birth, whether there were any complications at the time or during your recovery, the type of cut that was made in your uterus, womb, how you felt about your previous birth, whether your current pregnancy has been straightforward or whether there have been any problems or complications. How many more babies you are hoping to have in future. The risk increases with each cesarean section. So, if you plan to have more babies, it may be better to try to avoid another cesarean section if possible. To help you decide, your healthcare professional will discuss your birth option with you at your antenatal visit, ideally before 28 weeks. What if I have had more than one cesarean section? If you are considering a vaginal birth but have had more than one cesarean section delivery, you should have a detailed discussion with a senior obstetrician about the potential risks, benefits, and success rates in your individual situation. What is VBAC? VBAC stands for vaginal birth after cesarean. It is the term used when a woman gives birth vaginally, having had a cesarean section in the past. Vaginal births include normal delivery and birth assisted by forceps or ventouse, vacuum cup. What is an ERCS? ERCS stands for elective planned repeat cesarean section. You will usually have the operation after 39 weeks of pregnancy. This is because babies born by cesarean section earlier than this are more likely to need to be admitted to the special care baby unit for help with their breathing. What are my chances of a successful VBAC? After one cesarean section, about 3 out of 4 women with a straightforward pregnancy who go into labor naturally give birth vaginally. A number of factors make a successful vaginal birth more likely, including previous vaginal birth, particularly if you have had previous successful VBAC. If you have had a vaginal birth either before or after your cesarean section, about 8 to 9 out of 10 women can have another vaginal birth. Your labor starting naturally, your body mass index at booking being less than 30. What are advantages of successful VBAC? Successful VBAC has fewer complications than ERCS. If you do have a successful vaginal birth, you will have greater chance of vaginal birth in future pregnancy, your recovery is likely to be quicker, you should be able to get back to everyday activities more quickly, and you should be able to drive sooner. Your stay in hospital may be shorter, you are more likely to be able to have a skin-to-skin contact with your baby immediately after birth and to be able to breastfeed successfully. You will avoid the risk of an operation. Your baby will have less chance of initial breathing problems. What are disadvantages of VBAC? You may need to have an emergency cesarean section during labor. This happens in 25 out of 100. This is only slightly higher than if you were laboring for the first time, when the chance of an emergency cesarean section is 20 in 100 women. An emergency cesarean section carries more risk than a planned cesarean section. The most common reasons for an emergency cesarean section are if your labor is slow or if there is a concern for the well-being of your baby. You have a slightly higher chance of needing a blood transfusion compared with women who choose a planned second cesarean section. The scar on your uterus may separate and or tear. This can occur in 1 in 200 women. This risk increases by 2 to 3 times if your labor is induced. If there are warning signs of this complication, your baby will be delivered by emergency cesarean section. Serious consequences for you and your baby are rare. Serious risk to your baby, such as brain injury or stillbirth, is higher than for a planned cesarean section, but is the same as if you were laboring for the first time. You may need an assisted vaginal birth using ventouse or forceps. You may experience a tear involving the muscle that controls the anus or rectum, 3rd or 4th degree tear. When is VBAC not advisable? It's advisable normally. It's normally an option for most women, but it's not advisable when you have had 3 or more previous cesarean section before, your uterus have ruptured during a previous labor, your previous cesarean section was classical, where the incision involves the upper part of uterus, you have other pregnancy complications that require a planned cesarean section. What are advantages of ERCS? There is smaller risk of uterine scar rupture, 1 in 1,000. It avoids the risk of labor and the rare serious risks to your baby, 2 in 1,000. You will know the dates of planned births. However, 1 in 10 women go into labor before this date, and sometimes these dates may be changed for other reasons. What are disadvantages of ERCS? Repeat cesarean section usually take longer than the first operation because of scar tissue. Scar tissue may also make the operation more difficult and can result in damage to your bowel or bladder. You can get a wound infection that can take several weeks to heal. You may need a blood transfusion. You have a higher risk of developing blood clots in your legs or lungs. You may have longer recovery period and may need extra help at home. You will be unable to drive for about 6 weeks after surgery. You are more likely to need a planned cesarean section in future pregnancy. More scar tissue occur with each cesarean section. This increases the possibility of placenta growing in the scar, making it difficult to remove during any future deliveries, placenta accreta or percreta. This can result in bleeding and may require hysterectomy. All serious risks increase with every cesarean section you have. Your baby's skin may be cut at time of cesarean section. This happens in 2 out of every 100 babies delivered by cesarean section, but usually heals without any further harm. Breathing problems for your baby are quite common after cesarean, but usually don't last long. Between 4 and 5 in 100 babies born by planned cesarean section at or after 39 weeks have breathing problems compared with 2 to 3 in 100 following VBAC. There is higher risk if you have a planned cesarean section earlier than 39 weeks, 6 in 100 babies at 38 weeks. What happens when I go into labor if I'm planning a VBAC? You will be advised to give birth in hospital so that an emergency cesarean can be carried out if necessary. Contact the hospital as soon as you think you have gone into labor or if your water breaks. Once you start having regular contraction, you will be advised to have your baby heartbeats monitored continuously during labor. This is to ensure your baby well-being, since changes in heartbeat pattern can be an early sign of problems with your previous cesarean scar. You can choose various options for pain relief, including an epidural. What happens if I don't go into labor when planning a VBAC? If labor doesn't start by 41 completed weeks, your obstetrician will discuss your birth option again. This may include continue to wait for labor to start naturally or induction of labor. This can increase the risk of scar rupture and lower the chance of successful VBAC or ERCS. What happens if I have an ERCS planned but I go into labor? Let your maternity team know what is happening. It's likely that an emergency cesarean section will be offered once labor is confirmed. If labor is very advanced, this may be safer for you and your baby to have a vaginal birth. Your maternity team will discuss this with you. Thank you so much for listening. Hope it's useful for you. We will meet together next time soon. Bye-bye.